closer to the other party too. After all of them are their patients. So are we. So are we. The current scenario, I have seen doctors who can do anything to see that they are not disturbed from the environment in which they are working. I mean, they are also human beings. We too are. So it is fair enough. But the problem is, what do we do about villages where people are largely dependent on quacks? If I fall sick in a village today, if you don't have a sub-center or primary health center, if it is just a primary basic thing about vomiting or diarrhea, whom do I see? If there is no doctor in the village, the person I go to is a person who is educated. He will give me some home remedies, or you will go to a quack. What options you have? If you walk 15 kilometers away, there is no guarantee that there is doctor is going to be there. So we have to look out middle level health service providers. These boys and girls will be trained in the ambulatory health care, and they will take care of things which right now is handled by ANMs and ASHAs. ASHAs are not doctors, but they are giving medicines. ANMs are not doctors, but they are delivering children. These guys will be, after 10 plus 2, will have a 3.5-year course. They'll be slightly better trained than ANMs and ASHAs. And that is what we are aiming at. MCI has already agreed to the curriculum. The National Board of Examination is finalizing it, and we have written to the states accepting this. Now coming to the CSR. I don't know why this PPP thing doesn't work in many places. You might have heard many examples today morning, as you were telling me today that you heard very interesting cases. I was Health Secretary Kerala for 4 years, and Kerala is 15 years ahead of other states. I've not seen many things working. The basic mistrust between the government and the private sector continues. We always look at government as making only money, because we have seen this in medical colleges, and I see it very, very often now, dealing with medical colleges. How repeatedly I have to go to the parliament, and we find that the bill is not passed, because there are a lot of lobbies working against it. You know, how I find that despite having deficiencies, you still find that you have health service inspector providers who can arrange doctors, who can arrange patients, who can arrange equipments whenever MCI, DCI inspections are carried out. We know that. Doctors know it. Ministers know it. Bureaucrats know it. And yet we are doing this. Why is it that this continues for 50, 60 years? The fact is, the regulations we have come out are such regulations, like, for example, if you have to set up a medical college, it should be 25 acres of land. You will certainly not get it in Delhi. You will not get it in Gurgaon. You will go somewhere near Rewari. Find out 25 acres of land. Okay, you fix it. You establish teaching blocks. You have laboratories. You have hostels. You also need a hospital. Unlike engineering college, you need a hospital. If a hospital is there, you need to have basic equipment. And what about patients? Where are they going to come from? If they come from villages, can they really afford your treatment? Sitting in that place, if you invested 200 crores. So what happens when the MCI inspection happens? You have people brought in truckloads, shown as the OPD and the IPD, and you have equipments imported, you have all the journals shown, all the books, everything. This is known to everybody. I'm right now coming here after attending a parliamentary committee where the parliamentarians were also saying this. And I also recall that about 6 months ago, when the medical council discussions were happening, our honorable minister himself said that if I clear a medical college, there are five of you who will come and say that, why you have cleared? He doesn't have anything. You go and conduct inspection, there's nothing there. You do it surprise inspection, nothing is there. And if I don't do it, then you come with recommendations. मेरी constituency में college तो ठीक कर दीजिए, please. मेरी constituency में, this is very important to me. Deficiencies will take care, don't worry about that. So, you see, you have both the sides. So, my dear friends, this is what I have been telling the Medical Council of India, that have you been trained, basically, to take a measuring tape and go around measuring the lecture halls and the hostels and the principal's room and the libraries? What do you do with an auditorium which you are going to use only once in a year? Why do you talk about 15, 20 journals as one of the minimum standards when you know e-journals are there? Why do you insist on standards which forces people to do malpractices? Why do you insist on basic things which you are trained for? As a doctor, you are not trained to go around measuring this room, that this is what the minimum standards provide for. So change is the only thing which does not change in this world. Unfortunately, MCI refuses to change. And those people who do not understand the challenges of change will become victims of change. And very soon that time will come, I am very sure. One of the things which I tried as health secretary in Kerala was how do we rope in private sector to work with the government? Why not we attach some of our hospitals flooded with patients and attach with a private entrepreneur who has the money? So we forced MCI to come out with a regulation saying 10 kilometers. Allow a medical college to be set up in 2 pieces of land, 10 kilometers apart. Is it possible for us to attach this hospital with them, for clinical studies at least, so that he doesn't have to fake all those things? Well, MCI has been sitting on this for the last 1 year. Every week I keep calling them and they keep giving some excuses, but eventually we will be there. We will see that this public-private partnership works. How does it work? What are the difficulties in that we have to work? In Kerala, one of the things I tried in the government medical colleges, I realized the CT scans were not functioning, X-rays were not there, MRIs were not there. So I requested, I couldn't go to a private sector entrepreneur, but I went to a PSU, public sector undertaking, and I requested them that there are 3 medical colleges who do not have MRI. Is there any way by which we can have a partnership? And with great detail, in 3 months' time, we came out with some understanding. We gave them a place in the medical college. They bought the MRIs. We fixed the rates based on whatever price comes out. And we also said that 1 out of 10 patients has to be free. But the only thing you have to do is to ensure that this is done by your people. Because if it is my machine, my chaps will spoil it. Because 3 days, if the machine is not working, he gets some commission out of that. So please ensure that your people run that machine. Please ensure that the rates are this. And still our doctors were referring patients outside. But our people are not so stupid. You see, ultimately, if a machine is available in the medical college campus, why will he go out? If the rate is cheaper than what is given in the market, why will he go out? And there's no way that he can spoil it. Well, these 3 machines were installed and I was transferred out of that place. I came to Government of India, joined Ministry of Defence. We are jack of all trades, but we do become masters of some. We do become, sometimes. So I joined Ministry of Defence and now shifted back to health. And I was surprised to find out recently that the MRI rates in entire Kerala dropped down. They came down just by installing 3 machines. Just by installing 3 machines, the rate of MRI charges in the entire state dropped down. So it is possible. I think the possibilities of EPs in the healthcare is possible in diagnostic services.